morning, ma'am. I am a Princess Felix, a student nurse from Central School Las Piñas. So today po, I'm gonna demonstrate how to do the neck to abdomen assessment. So good morning, sir. I am Princess Felix po, a student nurse po. May I know po your name?
My name is Mix Formalieza,
Your birthday po?
January 11, 2006.
Okay, so, sir, explain ko lang dito sa inyo. So, I need to do this po I need to do this assessment po to you para po malaman if there are any pain, tenderness, or anything na nafe-feel mo po na you think is not okay or not normal. So, sir, before that po, I would like to ask po if what language do you prefer po? English po or Tagalog?
Tagalog.
Okay po. Mag-start na po tayo, sir. So, after nun po, close ko na po muna yung curtain, sir, for your privacy. And perform hand hygiene. So, I'm done na po sa hand hygiene. So, first po is we need to assess yung head movement at muscle strength ng patient. Can you look po sa left? And then sa right naman po. And then forward naman, sir. And then after that po nun is we need to ask the patient to rotate their head. So, can you rotate po your head? Okay po. Then after that, we need to apply a gentle resistance with our hands while the patient pushes against me. So, sir, okay lang po ba if manlaban po?
Sige po.
Okay, good. Okay. Dito naman po. Okay. Dito po. Okay na po. Backward, sir. Okay na po. Okay, so, sir, may nafe-feel po ba kayong sakit, pain, or nanghina po ba kayo?
Wala naman.
Okay po. So, ang normal findings po dapat na itong assessment na to is full range of motion with no pain or weaknesses. Okay, so, next po is we need to palpate the neck for enlarged lymph nodes. So, what are we gonna do here po is we need to use our gentle circular motion using our fingertips, palpate yung lymph nodes natin. And i-check po natin yung following areas. Preauricular, post-auricular, submandibular, and yung cervical chamber nila. Ang preauricular naman po, nakikita siya sa in front of the ear. Ear po. So, no signs. And then after po nun is yung post-auricular, sa likod po ng ear. Wala rin po. And then yung sa submandibular, sa under ng jaw. Wala rin po. And then last one po yung sa cervical chain niya. Yung sa neck naman po, along the sides of the neck. So, wala naman po. Ang normal findings po dapat walang swollen, tender, or hard na lymph nodes na mararamdaman tayo. So, after that po is we need to palpate the trachea for bulges and tenderness. So, what we're gonna do here is we need to place our fingers on both sides of the trachea and check if it is midline. So, ang abnormal findings naman po dito is yung tracheal deviation po is kapag may tracheal deviation po, it may indicate lung or thyroid issue. So, since po wala naman po, And yung midline naman po niya is good. So, we have no issue about it po. So, the last one po is yung we need to inspect the thyroid gland. So what we're gonna do here is we will ask the patient to stand behind the patient and ask them to swallow while we observe yung neck nila. Sir, can you swallow po? Swallow agad. Swallow. Okay, so for the lungs and thorax assessment naman po, is we need to inspect the shape and symmetry of the thorax. So, gagawin po natin dito is observe lang po natin yung chest ni patient for symmetry, the deformities, or abnormal breathing patterns. So, sir, breathe po normally. And then, yun nga po, we need, ang reason po na to is we need to look for signs ng barrel chest or asymmetry or asymmetry po kasi kapag asymmetry siya, meron siyang lung collapse or scoliosis. So, next naman po is we need to inspect the spinal alignment for deformity. So, to-check po natin if yung spine niya is straight and midline, and check for abnormal curvatures like scoliosis, kyphosis, or lordosis. So, sir, can you stand po? Stand. Po. So, can you sit na po, sir? Sit na. Yan, sit. Ito po is para i-check if yung spinal niya is straight or may signs siya ng scoliosis. Okay, so there are no signs naman po ng scoliosis. Harap ka na po. So, after po nun is we need to palpate the thorax for bulges and tenderness. So we need to use our both hands po to gently press along the rib cage and ask if the patient feels any pains or discomfort. Straight. Sir, masakit ba?
Hindi.
Sabi ko, sir, pag may masakit.
Wala po.
Okay, so there are no signs of pains naman po. And after that po is we need to palpate the chest for respiratory excursion. So what are we gonna do here po is we need to place both hands on the lower ribs and ask the patient to take a deep Can you take a deep breath po, sir? Go. Deep breath.
Oo, okay na.
Hinga. Okay. Okay, so kapag asymmetry po, it may indicate collapse lang or yeah. So, next naman po is we need to palpate the chest for vocal and tactile firmitudes. So, we need to place our hands in the chest and ask the patient to say 99. So, can you say 99?
99.
may naramdaman po akong vibrations. Kapag ang vibrations po is mataas or increased vibrations, it suggests na may pneumonia siya or fluid. And then if naman po decreased vibration po, it may suggest ng air trapping or COPD or what we call barrel chest. And then after that naman po is we need to percuss the thorax. So we need to tap lightly on the chest wall to listen for resonant or normal, or dull or fluid mass, or hypersonant or trapped air sounds. So last naman po is we need to auscultate the chest. So we need to use our stethoscope po to listen to lung sounds in at least 6 to 8 spots on the front and back. So, the result naman po here is normal breath sounds or vesicular. So, next naman po is for a heart assessment. So, first is we need to ask the patient to remove their shirt. So, can you remove your shirt po?
Sure po.
And then, after that po is we need to inspect and palpate the precardium. So, we need to look for any visible pulsation or abnormal movements such as the patient. Breathe normal lang. Okay, so after that po is we need to place our hands, isang hand lang pala, over the heart area to feel kung may vibration ba or merong forceful beats. after that po is we need to assess naman sa neck vessels. So dito naman is we need to assess yung carotid arteries ni patient. So we need to ask the patient to sit up straight and turn their head slightly. Ito po yung titignan natin yung carotid arteries niya. Okay, and then after that is we need to inspect yung neck niya on both sides for obvious arterial pulsations. So, dito naman is we need to look for visible pulse waves sa neck niya. And then after that naman po, kapag excessive pulsation po, it may indicate na mayroon siyang heart problem. So, there are no signs naman po na excessive pulsation. Yung pulse niya naman po is normal. And then, after that po is we need to palpate each carotid artery separately. So, in this case naman po, we don't need to palpate the both sides at once kasi it may cause the patient to faint. So, we need to do it separately. And then after that naman po is we need to place the bell of the stethoscope over each carotid artery to auscultate for the blood. So in this case naman po is we need to ask the patient to hold their breath while listening for blowing sounds or impulse nila, which suggests po ng arterial narrowing. So can you hold your breath po? Hold your breath. Another one. Inhale. Exhale. Hold. So the sounds po is normal naman po. And then after that po, lastly is we need to palpate yung peripheral arteries on both sides. So dito naman po is we need to compare yung pulse strength niya, yung elasticity, symmetry of the arteries sa arms and legs niya. For the breast and axilla assessment na po, is we need to inspect and palpate the breast for size, symmetry, contour, discoloration, and yung dimpling niya. So, to inspect the breast po, we need to inspect the breast in 4 positions. So, sir, can you do the arms outside po? So, next naman po is yung arms overhead. Arms overhead. Overhead. And then next naman po is yung hands is pressed on hips. And then lastly naman po is yung kapag naka-lean forward is lean forward. So after that po is you need to inspect and palpate yung areola nila and dimples nila. So in this case po, we need to check if may discharge, retraction, or any abnormalities. So yung color naman po is normal. Yung size naman po na is normal din. And then there are no signs of discharge din po. So lastly po is we need to palpate the breast and axillary leg bones. So in this case naman po is we need to use a circular motion to feel for lumps under the breast and yung armpit nila. Taas ka naman po. Hindi naman taas ka naman. There are no signs po ng lymph nodes under his breast pala. So for the abdomen naman po, first po is we need to make sure that the patient po has an empty stomach before we proceed to that procedure. So for the first one po is we need to inspect the abdomen. So we need to look for contour, symmetry, scars, or peristaltic waves. So, there are no signs of scars naman po on the peristaltic waves. The contour is smooth and the symmetry and contour is good naman po. So, so we need to observe for this tension and abnormal fixation. Okay. And then after that naman po, we need to auscultate the abdomen. So we listen for bowel sides and all four quadrants. So after that naman po is we need to uppercast the abdomen. So tap each quadrant and listen for tympani or dullness. So habang inaano natin. After that naman po is we need to palpate yung specific organs niya. So, for the livers naman po, we need to place hand under the ribs and ask the patient to inhale deeply and feel for the liver edge. Liver dito ba? Diba? Or can you inhale po? Inhale, sir. Inhale. Ito na. Exhale. Liver ito, di ba? Inhale, sir. Exhale. So, for the spleen naman po, we need to palpate under the left rib cage while the patient takes deep breaths. Inhale. Inhale. Exhale. Inhale. Exhale. Inhale. 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 Exhale. Inhale. Exhale. So, for the kidneys naman po, you need to use the ibang bimanual technique to feel for kidney enlargement. And then last one naman po is sa bladder is we need to check for distension or tenderness.